Okay, so good morning, everyone. We had a bit of a technical difficulty, so I couldn't go live, but I am here with Dr. Mary DeShields, and we will record the interview and I will post it later today. So, good morning.
Good morning.
It's so good to see you.
You too.
So, October is Breast Cancer Month. Here at Fayze, Bling, and Tings, we acknowledge Breast Cancer Month, the survivors, the fighters, and the support systems. So, Miss Mary, first, I would like for you to read this.
Okay.
We will start at She Is.
Okay. I have to get.
You need your glasses. I'll read it. Don't worry. Oh, she said I gotta get my glasses. Okay, so now I need my glasses. Well, here we go. So, Miss Dr. Mary DeShields. She is such a beautiful woman, inside and out, very soft-spoken, intelligent but not arrogant, kind. Miss Mary loves the Lord. She believes in His word. Faith. I say these things from my personal time in her presence. Most memorable thing about Miss Mary would be her smile. It's warm, it's comforting, and it's welcoming. Miss Dr. Mary DeShields, ladies and gentlemen. Woo! So, you are an oncologist.
Yes, I'm a medical oncologist. And first, thank you so much for asking me to be with you today.
You are very welcome. You are very welcome. Now, I have done a little research. So, oncologist, there are three divisions. So you said you're medical.
Medical.
And then there's surgical and radiation.
Exactly.
Okay. So medical. So when I come to you, have I already been diagnosed or yes?
In most cases, yes.
Okay. And what are the cases that you deal with?
Well, I practice all types of medical oncology, or rather, I treat every type of malignant disorder.
Okay.
That's the nature of medical oncology.
Okay.
I mostly see breast cancer patients, breast and ovarian cancer, and that's probably gender driven.
Okay.
But the bulk of my practice was breast cancer and ovarian cancer.
Oh, okay. Do you have, as far as breast cancer, is that the highest reoccurring cancer?
Among women, yes.
It
is the most frequently diagnosed cancer among women. Probably the only one that comes close is lung cancer. But breast cancer is the leading cancer that affects most women during their lifetime.
Okay. When I was growing up, it was always older women. I got a call last week from a really good friend, her daughter, 22.
It is alarming to have a breast cancer diagnosis in such a young individual. For a number of reasons, we're seeing an increase in cancer across the board in young people, and that probably has to do with some environmental issues. We're seeing more cancers, not particularly breast cancer, but some of the gastrointestinal malignancies related to dietary choices and lack of physical activity, and especially in younger people. And some of it probably I believe, has to do with the change in our diet over time from a natural, essentially plant-based diet when we were growing up,
Right.
where meat was the side dish,
Yes.
to now meat becoming the
Main
dish.
dish.
I'm not anti-meat. I'm not. I'm not a
She said,
vegetarian,
"I'm
not a
not."
vegan.
Okay.
But I think the more natural products we can incorporate into our diet, natural meaning, I should rephrase that, plant-based products, fruits, vegetables, that we can get in, the better.
So there are ways. What are they called? Precautions that we can take.
Yes.
Okay.
Things that can lower the risk of cancers of all types.
Okay.
At the top of the list is physical activity.
Wow.
And it doesn't
I
mean
can't be a couch potato anymore.
and it doesn't mean you have to pound the pavement.
Right. Okay.
It doesn't mean you have to jog 5 miles a day. Something as simple as a 15-minute walk a day, particularly after a meal. You know, things you enjoy, gardening, caring,
Blinging.
anything that gets you moving. Dancing, cycling, whatever it is that brings you joy and gets you moving is important.
Is it necessarily so that when I come to you, is it a death sentence?
Absolutely not.
Okay.
And Faye, if there's one thing I'd like to have your guests remember today, that cancer is not a death sentence.
You hear that, guys?
Yeah, you can't survive it.
Okay.
Survivorship now is better than it's ever been.
Okay.
For instance, I've been practicing oncology now for 30 years. And when I started in my career in oncology in the late 80s, the prognosis for most women, especially with advanced cancer, was 6 months or less.
Oh,
and that was for everyone. But there are individuals with advanced cancer living for years, some even decades.
Wow.
So it is not a death sentence anymore.
Wow.
And I'm just so glad to be able to share that news.
If I was a patient, I would be just so far down. Like, what do you do? How do you deal with women who are hopeless with the diagnosis? Just can't seem to get past the word, you have cancer. How do you deal with the emotional side of your patient?
I try to meet them where they are. I understand how crushing the words are. You have cancer. Cancer has affected members of my own family, so I've witnessed it firsthand. And we start from there, where they are, and then we start to build up. I hope to never minimize the suffering and sadness someone feels over their diagnosis, because it's real.
Yes.
What I do tell them is that these are the facts. This is a cancer. This is the stage. And most people now go on Google.
Oh, yeah.
And so, or some type of web
medical forum.
Forum. And you get all kinds of information. So the first step is to say that information is very broad, it's very general, and it might not apply to you.
Right. Okay.
This is what you have, and this is what we can do, and this is how we're going to move forward.
Okay.
One day at a time.
One day at a time. In faith.
In faith. Faith is a big part of it. There are varying levels of faith. Some have deep faith that's been practiced for many years, and some not so much.
Right.
Some not at all.
At all, right.
And so I try to meet them where they are too. To say that we have to, in the midst of all of the sadness, we have to find something to hold on to.
Yes. Yeah. I have a really good friend who is 19 years breast cancer free. Can breast cancer come back? It can come back. So even though you're breast cancer free for such and such and such, it can come back into remission. Okay.
And we call that a relapse of cancer. And when it comes back after decades, the question most oncologists ask, is it the original cancer or is it a new one that's formed? Because that's possible also.
Oh, okay.
And so the investigations start all the way over from round one, and we try to figure it out. And the beauty of scientific advances is that we're able to map tumors based on their genetic expression. What does their DNA look like? What is their makeup at the cellular level telling us about how this cancer operates?
Okay.
And that gives us tools to fight it.
Oh, okay.
So it's like you have a weed in your yard and you say, okay, this weed doesn't like garlic. So what are you going to do?
Give it garlic.
Give it garlic.
Okay.
And that's a very simplistic way of how we match treatments to the cancer type. And all breast cancers are not the same.
Okay.
They don't behave the same. There are different genetic expressions. Based on that, we choose the best treatments.
Okay. In my research, the 5-year pill. Could you explain that?
Yes, and that's based on genetic expression.
Oh,
That's
okay.
what I'm talking about.
Okay.
That was one of the first you might have heard, your audience might have heard of targeted therapy, precision medicine. Well, that was one of the first ways of treating specific types of breast cancer that express estrogen receptors. Women make a hormone. We manufacture a hormone in our bodies called estrogen. That's what makes our skin beautiful. That's what allows us to bear children. Sometimes breast cancer cells will also express an affinity for estrogen, meaning they grow in the presence of estrogen. So those pills are designed to shut off the supply of estrogen.
Okay.
So it starves the breast cancer cell.
Gotcha. Okay.
And it does not cause as many side effects as
that was my next question. Yes,
yeah.
Side effects. So not as harsh?
Not as harsh.
Okay.
Still, it's medicine. It's strong medicine, but it's not as harsh as chemotherapy. For instance, it doesn't cause hair loss and the nausea and vomiting that sometimes chemotherapy can do.
Okay. So with the pill, are we still doing the chemo, or is that the treatment?
It depends on genetic expression. Again. For instance, there's some cancers that says, well, we need to take a multi-pronged approach to treating this cancer, meaning we need chemo and the pill to treat it.
Okay.
And then there's some that says this cancer isn't the type that will respond to chemo, so we'll just use the pill. And then there's another type that does not respond to the pill at all. So our only tool is chemo.
Okay, so it's on a basis, certain basis.
Case by case basis, yes. And that genetic expression, tumor profiling is what we call it. It's saying we're going to find out what makes you tick, and we're going to go after it.
Wow.
And that's what we do in medical oncology.
So it seems like the technology from the 80s till now has really grown.
It has exploded for all cancers. And for I was looking at statistics the other day, for the last 20 years, cancer survivorship has improved. Now, that doesn't say that everyone will make it. But for the general population, it's getting better.
It's a good thing.
It's a good thing.
Good news.
It's good news. A caution, though, with the good news is that our people, African American people, are still lagging behind in benefiting from some of these therapies for a number of reasons. And we could talk about that in another.
Okay.
When you're ready.
I'm ready, and I would like to get back to that. I would definitely love to come back and talk about that.
Okay.
So, are there any bits of advice, or if someone is wanting to go and get a mammogram, where would you send them if they need like I said, if they're so far down and hopeless, what would be the first thing you would tell them to do?
After a cancer diagnosis?
Yes.
I would say we start from here and listen for the next steps. Many times you've heard of can't see the forest for the trees
Mm-hmm.
effect. So sometimes when our attention is drawn to a particular thing or point in our life, we can't really see the big picture.
Mm-hmm.
And I've treated a number of young women who come and they have young children and they're already thinking, I'm not going to see my child graduate. I'm not going to see my baby grow up.
Mm-hmm.
And I accept that. But what I advise is, in order to give you the best chances of seeing your child grow up, you have to do these things. And let's focus on doing these things right now. And day by day, we'll get to that point.
Are there any support groups, Miss Mary?
Yes. Yes, there are support groups. Almost at any cancer center or office that's affiliated with a hospital or university program will have support groups.
Okay.
There are also online support groups. Have to be a little bit cautious about those because negative information tends to be juicier than positive information.
Okay.
So
I can understand that. Yeah.
So if you're finding it, be careful with if it's a group that's all gloom and doom, that's probably not the right group to be in.
Right. Okay.
But yes, there are breast cancer, cancer survivor support groups.
Okay. A mammogram. Where would we go for our first mammogram?
Usually mammograms start in most women around 40 years old. The reason for that is, until then, the breast is very, very dense, and it's harder for a mammogram to really distinguish between normal breast tissue and cancerous breast tissue. But that's changing because technology is getting better.
Okay.
It is important to do breast self-examinations.
Could you say that again?
It is important to examine your breast. Pick a day of the month, preferably not the week before your period, because at that time the breasts are getting very tender and the hormones are really circulating.
Okay.
And the breasts can get lumpy during that time, and they're benign.
I thought about that. Okay.
So let's say pick a week after your period is probably the best.
Okay.
Because the hormones are at their lowest point at that time.
Okay.
And learn how you can. There are resources online for how to examine your breast.
Okay.
Each woman is different. The breast might be a little bit asymmetrical, but get familiar with
your breast.
Your breast.
Yeah.
And it's especially important in young women because mammograms don't always pick them up in very young women. That is, women in the 20 to 30 year age group. The breasts are just so dense. After that, in my age group, mammograms are very useful because the breasts are mostly replaced by fat.
Okay.
You can see through fat. You can't see through the dense breast tissue in young women so well.
Gotcha. Okay.
To have where to go for a mammogram, most hospitals will have a mammography department.
Okay.
In Easton, there is the Clark Breast Center.
The Clark Breast Center.
It's affiliated with the University of Maryland. It's an excellent place to
get a mammogram.
Okay. And there is a team of medical professionals who only deal with breast cancer at the Clark Breast Center. So that is advantageous.
That's what they do.
That's what
That's
do,
it.
day in and day out.
Gotcha. Okay. And that would make me feel a lot more comfortable knowing that this is what they do.
That's right.
You know, they don't have to guess, or this is their specialty.
That's right.
So that makes it a lot better. So I think we have come to the end of our segment, unless there's anything you would like to let our guests know.
Again, I just think it's a beautiful thing you're doing.
Thank you.
So creative. I love your product.
Thank you so
And
much.
most importantly, the information you're sharing. Thank you for having me today.
Thank you so very much for joining me. Thanks, guys.